Okay, welcome. This is Dr. Herr here. What I want to do is I want to go through a few joint motion mobilities, the ones that we discussed in our class. And these are personally the ones that I use in the morning to get my day started as well. So we'll start off first. We're going to work from the top all the way down. We'll start with some movement of the cervical spine. First, what I have you do, we're just going to do some flexion extension. So we're going to chin down and back up. Down, and back up. Really important when we're doing any of these mobility exercises that you should not be moving point past pink, because if you have any pain or discomfort, don't move past that. Next we'll do towards the right as far as you can go, towards the left, again towards the right. And we want to always do these, any movement that we do in the body, a nice controlled motion. Okay. Next, we're going to go right ear to right shoulder, back to center, left ear, left shoulder. And you want to watch here, notice how I'm minimizing, making sure that my shoulder does not come up. Okay. Right ear, right shoulder again. Left ear, left shoulder. Okay. And then we'll do some circles. We start with the chin on the right side, bring it down, and across. You notice how I'm not bringing my head back. Okay, then the shoulders, to get the mobility in our shoulder joints, we start off with some small circles going forward. Okay, and then we go back, bigger circles, and we can get them as big as we can. Okay, and then we get back to the starting point, and we'll go backwards. So small circles again. And big circles, nice and big. Okay, the other one that's really important to do is for our shoulder blades, especially because of the type of posture that we're in. Majority of people now that are working are spending a lot of time in front of the computer. So what we want to do is we want to get these shoulder blades, the scapula moving. So I call this protraction, retraction. So what you want to do, hands to the side, and what you're going to do is, I'm going to show you from the side view here, and then also from the front view, as you take a deep breath in, and as you exhale, you're going to bring the chest forward, and you're bringing the shoulder blades back, trying to squeeze them together. And then we're going to push forward. Okay? And then back, bring the chest out, squeeze the shoulder blades together. Okay? So that's how it looks from the side, and from the front. Chest out, bring the shoulder blades together, and then push the hands out, spreading the shoulder wing. So what you're doing, in essence, with this movement is, if these are the shoulder blades, we're spreading them out, and when we're retracting, we're bringing them right back, trying to touch. Okay. Also, we can do their shoulders. Some more shoulder mobilities, small circles in front. Okay. You're always going to go clockwise and counterclockwise. Okay, and we do the elbows. So the elbows, circles. Okay, always want to make sure you don't want to punch yourself in the face. Okay, and have some fun while you do these. Maybe sometimes you play your favorite music. You can do these in front of the TV. Okay, then we go into our wrists. Okay, so small circles with the wrist. And then we'll go the other way. And this movement here, for people that are on the computer with their mouse, just go side and then in. So what you're working on right here in the wrist, you can see it this way, side, out, back in. Okay, so out and back in. And then moving the fingers, okay, spreading them, circles with the thumbs. And this is the great thing about this, this takes approximately 5 minutes. Beautiful way to start your morning. Do it first thing in the morning. We do the pelvis. Okay, so pelvis, we're going to start with our circles. Start from the right, and across, and then come back. Across, and come back. Okay, and then we can do some what we call pelvic tilts. And for the pelvic tilts, what I want you to imagine is that you have a rod that is actually going right across your pelvis, and on the ends of that rod there are two dials. And what you can do is, with the dial, you're going to turn forward, the pelvis is going to go forward, and if you bring the dial back, the pelvis is going to go back. A little bit easier to see here from the side view, so you can do the pelvic tilt, okay, and then back, okay, and forward. So you almost feel your stomach going in and out as well, okay. Another one too is for the hips, so we call pendulums. If you have some issues with stability, you may want to place your hand on a wall, someone, get a stick or a broom to help. But what we're going to do today, we're just going to demo them without any stability. So what you're doing, you're rocking the leg forward. Okay, really opening up the hip joint. These are joints that get really tight in long periods of sitting. Okay, we do the left as well. Okay. And the side, just like one of those, the reason it's called a pendulum, looks very much like a pendulum. Okay, and then we go even in front, side to side. Some of you are going to be able to get that leg up nice and high, some of you a few degrees, but that's what this whole joint motion is about, is getting more mobility into your joints. Because not only is this good for your joints, it's very good for your nervous system. Because what you're doing is you're forcing the brain to send information to your joints, and now the joints are feeding your brain with some information and what they can do to help with the repair and healing process. Okay, knee. Okay, you get the knees together. You want to make sure, so you can see from this point here, never want the knees in front of the toes. Okay, so slight bend, and what you're going to do is knee circles. Okay. Okay, and then we can front and back. Remember, when you're doing any of these joint motions, you want to do them slowly and safely. And then the other one. Okay, and we do the ankles. So do some circles with the ankles. Make sure that you're always doing both sides. We want to make sure that you're balanced. Okay, and then you can even do your circles if you have the stability in the air. Always a little bit more challenging. Okay, and then what you can do is work on the inside and the outside of the ankle. This is a little more challenging. You want to be careful, especially if you had repetitive ankle sprains, but just getting on the outside, okay? And getting back on the outside as well, okay? So that's a really good point for you to start with some of the joint motion. I hope these exercises have been helpful, and I look forward to seeing some of the changes in your health when you do these exercises. Thank you. Take care.